Okay, move on. BMI, body mass index. Body mass index, so apparently we've had a few questions about this, about what body mass index do I need for surgery. There is no absolute. In the NHS, you'll find there's an absolute. And this is normally body contouring surgery we're talking about, not so much mole, cysts, lumps or bumps. There's not really a BMI for that. But it's for body contouring, so in bigger operations, tummy tucks, mastopexies, breast reductions, big operations, there is a BMI guideline simply because the complication rate is higher if the BMI is higher. It's a bit like smokers. Got nothing against people who have got high BMIs or nothing against people who smoke. That's absolutely fine. But it can increase your risk of complications. So that's the reason for this. We're not being sort of discriminatory against people. It's because the complication risk is higher in people with high BMI smokers. But I'm not going to talk about smokers because that's not the question. So I'm going off beast again. So BMI is the question. So I normally work on a BMI of 30 is the number that I normally work on in my own mind. And I'm looking if the BMI is below 30, it's good. If the BMI is above 30, it's not so good. But it's not an absolute thing. So the main thing is, I hope you're well. The main thing is you've got to be stable and comfortable with your weight. Well, no, there's two things. First of all is the absolute value of the BMI. So if it's way over 30, if it's 40, then I think you've got a very high risk of complications and you will be better off losing weight prior to having surgery. However, if it's just a little bit above 30, or even, to be honest with you, even if it's below 30, you've got to be stable and comfortable with your weight. So if you're not stable and comfortable with your weight, you should do that first. You shouldn't really have body contouring surgery like a tummy tuck or breast lift or something like that when your weight is changing. Because the reason you need a body contouring surgery is because the skin has been stretched, usually by putting on weight or having children. Those are the two things that can do it. And then when the stretching force goes, you're left with this redundant skin. So if you lose weight after surgery, you might be left with more redundant skin. So you really need to be stable and comfortable with your weight. Number one, because your complication rate will be less. But number two, because you will have a better result because I'll be able to make the skin tighter if you've lost your weight first. If I make the skin as tight as I can, then you go on and lose weight, I might have been able to make skin tighter if you lost the weight first and you've had a better result because your complications would have been less. So all in better result if your weight is lower. But BMI is the ballpark. BMI of 30 is the ballpark we work on. If you don't know what BMI is, it's the body mass index, kilograms per meter squared. So it's your weight in kilograms divided by your height in meters squared. That's how you work it out. I think there's sort of things on the computer to work that out all over the place if you need to work that out. So that's the BMI. Good.